Steph_Kagina08 had asked, what would you advise for a child who has allergy to eggs? If he takes eggs, he gets boils on the forehead, the nose area. So actually today's topic has been inspired by Steph. We're going to talk more about allergies, and hopefully by the end of this talk, I will have been able to answer Steph's question on egg allergies. So I'm sure you're wondering, what exactly is an allergy? When people tell you, oh, I'm allergic to eggs, I'm allergic to this, I'm allergic to that, what is the background of what this allergy is? So basically, an allergy is just an abnormal immunological response to otherwise normal stimuli. For example, you'll find I can eat like 20 eggs in a day, but when someone just smells eggs, I'm exaggerating, but when someone just smells eggs, you find that, oh my god, they start getting hives and things like that. Or someone can stay in a dusty environment for the longest period of time, and when someone like me goes there, I'm congested, I'm coughing, I'm sneezing. So it's basically just the immune system overreacting to an otherwise normal stimuli, and it results to those physical manifestations. Someone can get rashes, someone can get hives, someone can get nasal congestion, runny nose, difficulty in breathing in severe cases, which can be really serious. So just things like that can result in allergic reactions. Even sometimes to some extent you can have some bit of vomiting, a bit of diarrhea. All these can be physical manifestations of allergies. And according to the World Health Organization, actually, we're beginning to see more and more allergic reactions, especially in children, in the general population worldwide. Most allergies are mild to moderate. So you will find the patient is just having maybe runny nose or rashes here and there that self-resolve without any form of intervention. But sometimes these allergic reactions can bend towards the serious category, especially when you have severe difficulty in breathing and hives and upper airway obstruction just because of the allergic reactions. So in such an instance where you have this severe manifestation of an allergy, it is known as an anaphylactic reaction. And in these instances, early care saves lives. So when you see such a patient with a severe form of the allergic reaction, and in our setting we really have difficulty getting EpiPens, rushing them to the nearest hospital to be able to be given adrenaline will be life-saving. So what are these common allergies that are mostly found in children? We have food allergies. For example, you can be allergic to proteins, things like meat, eggs, milk. You can be allergic to nuts like peanut butter, hazelnut butter. You can be having something known as allergic rhinitis, where you get runny nose, especially when you're exposed to dust and things like pollen. You can have drug allergies, which can sometimes be up to a severe form. And you can have eczema-like allergic tendencies. So patients who are having things like atopic dermatitis or a family history of eczema or asthma tend to have this eczema-like allergic tendencies. And coming back to Steph's question on egg allergies are one of the most common childhood allergies that a pediatrician is going to encounter as they're managing patients. And there are so many myths that I need to dispel regarding egg allergies. Actually, you'll be told that if one of your children is allergic to eggs, then all your children are allergic to eggs. That is not the case. If one of your children is allergic to eggs, you have so many different genetic variants. It does not mean that all of your children are allergic to eggs. If you find your child is getting some allergic reactions, especially after eating eggs, it is good to avoid the allergen for a few days or months and slowly introduce the allergen. This is going to help to boost the child's immunity as well. It does not mean that once a child gets an allergic reaction to a certain food type, then they are supposed to avoid that food for the rest of their lives, especially when it comes to egg allergies. When it comes to things like nut allergies and those other things, then that becomes a different topic, but I'm answering Steph's question. Something else is you're told that you should avoid introducing these foods to children early because it's going to predispose them to allergies. Actually, that is not the case. In fact, World Health Organization advocates for early introduction of these foods as long as the patient is ready to take solids. So introducing these foods at between 6 to 1 year of life is very important because it helps them to be able to have been exposed to these foods earlier and to build the necessary things that are needed to be able to digest this food well. Allergies are common, but with proper information and proper care, they can all be easily managed. Remember, early recognition saves life. every child needs a fighting chance.